Let's talk about the mistakes people make when taking their own blood pressure. What's crazy is that even some doctors' offices make these same mistakes. We need to go over these because they can give you artificially wrong numbers. If you get a reading that's way too high, you might worry you have high blood pressure when you actually don't. It could just be a simple mistake. If you care about protecting your body with real facts instead of marketing hype, hit that subscribe button right now. Alright, let's jump right in. Number 1. Using the arm cuff over your clothing. You're supposed to put the cuff on your bare skin. If you put it over your shirt, it can give you an artificially higher number, sometimes by 10 to 20 points. That's a huge difference. Number 2. Your arm isn't at heart level. If your arm is dangling down while you take your blood pressure, the cuff is way below your heart. You want to rest your arm on something, like a table, so your elbow is supported and the cuff is level with your heart. Even doctors sometimes get this wrong. Mistake number 3. The cuff is too tight. So how do you know it's right? Well, too loose is when you can fit your whole hand under it. When you tighten it, you should be able to slide 2 fingers between the cuff and your arm. 3 or 4 fingers is too loose. If you can't get your fingers in at all, it's too tight and will give you a higher reading. Number 4 is a big one. High blood pressure is defined as an abnormally high reading asterisk at rest asterisk. You're not supposed to test it right after you've run up a flight of stairs or when you're super stressed. Think about it. You rush to the doctor's office, maybe walk a long way from your car, you're stressed, and they immediately take your blood pressure. Of course, it's going to be high. The proper way is to relax for at least 5 to 10 minutes first. If they don't give you that time, ask them if you can just sit and breathe for a few minutes. Number 5. Having a full bladder. Did you know that can raise your blood pressure? When you really have to go, it stimulates your fight-or-flight system. So make sure you empty your bladder before you get your blood pressure checked. Mistake number 6 is crossing your legs. It's an easy mistake to make, especially when you're sitting on an exam table. But crossing your legs can artificially increase your blood pressure. Make sure your feet are flat on the floor, uncrossed, and you're in a relaxed position. Number 7. Caffeine. Having coffee or anything with caffeine before your appointment can significantly raise your blood pressure, sometimes by 20 or even 40 points. It takes about 20 minutes for the caffeine to kick in, and its effects can last for hours. So, having coffee an hour before your appointment means your reading won't be accurate. It's best to have an empty stomach for 2 to 3 hours beforehand. Number 8 is using the wrong arm. This drives me crazy. The standard is to use the left arm. It's about standardization. If the nurse immediately goes for your right arm without a good reason, like surgery or an injury on your left side, they're not following the textbook procedure. Taking it on the right arm without a specific reason makes about as much sense as taking it on your ankle. Number 9 is using a wrist monitor instead of an arm cuff. The arm cuff is the standard for a reason. Wrist monitors can be a bit more inaccurate. They're not going to be wildly off, but they won't be as precise. You often see these in dental offices because it's quick and easy, but they aren't the most accurate way to get a reading. Number 10. Talking while the test is being done. You know the scene. The nurse is putting the cuff on while asking you questions about why you read there. Talking raises your blood pressure. You're supposed to be quiet and relaxed to get a true resting measurement. And the final mistake, number 11, relying on a single reading. One high reading doesn't automatically mean you have hypertension. True high blood pressure is consistently high. If a doctor wants to put you on medication after just one test, that's a big red flag. You should be taking averages over time at different times of the day to see the full picture. Learning to use a blood pressure cuff correctly is so valuable for getting true numbers. If you found this video helpful, give me a thumbs up and subscribe to the channel. Thanks for watching.